So we will go on with a totally different subject, and I will discuss the assessment of endothelial function during cardiopulmonary bypass, and thereby I will specifically focusing on the assessment of microcirculatory perfusion. So I have no disclosures related to this lecture. So one of the main goals of hemodynamic monitoring is to maintain adequate tissue perfusion. However, tissue perfusion is mostly regulated within the microvasculature and not really by the aortic blood flow. So just refreshing your memory, so the microvasculature consists of three kinds of vessels. So we have the arterioles depicted here in red, the venules depicted in blue, and then within the capillaries. The main important goals of the microcirculation is to regulate local blood perfusion, which mainly happens within the arterioles, and the capillaries and the postcapillary venules are involved in gas exchange. So we have the oxygen and the nutrients going from the circulation into the surrounding tissues, and the carbon dioxide and the waste is going from the tissue back into the circulation. So this is very nicely shown over here, where you have the oxygen content within the arterioles and in the venules. So the arterioles here on the left, the venules on the right, and you can see that the oxygen content in the venules is way lower than within the arterioles. So 2/3 of the oxygen extraction takes place within the capillary network. So you can also imagine that we want to maintain the perfusion within the microcirculation. So if we dig into the literature, we already know that there are a lot of causes due to bypass that disturbs microcirculatory perfusion. So for example, hypotension, hypothermia, loss of pulsatility, hemodilution, and a decrease in viscosity. We have the systemic inflammatory response syndrome, and we have endothelial injury. So they can all lead to disturbed microcirculatory perfusion. However, it's still difficult to monitoring the microcirculation during cardiac surgery. And here this is an overview of several techniques to monitor microcirculatory perfusion, and it's still not complete. But I would like to emphasize is that that we can divide them by direct measurements of perfusion or indirect measurements via the measurement of oxygenation. So I will discuss a couple of these techniques, mostly the ones that are performed nowadays or are the most promising for the future. So if we go a little bit into the past, around 1960, the nilfold capillaroscopy was developed. This is a technique based on illumination, and it's mostly applied onto the nilfold capillary bed. However, the nilfold capillary bed is extremely sensitive to external temperature and vasoactive agents, and especially in critically ill patients. So this was not really a reliable indicator of the microcirculation for other parts of the body. So it took some years, but then we had orthogonal polarization spectroscopy, OPS. And this is what we call the first generation handheld bedside imaging using polarized light. So this is a non-invasive method, and it investigates the mucosal side, and most of the research has been performed in the sublingual area, which is the capillary bed under the tongue. So, and from that moment, there was a general recognition that the microcirculation is an important physiological process, which is compromised in critically ill patients. So after that, the development went very quickly. So the second generation handheld devices is called the SDF, Sidestream dark field imaging, and this is a technique that is nowadays commonly used. So you can see very nicely the erythrocytes flowing within the capillaries. So here you have an arteriole, here you have a venule, and these small ones are the capillaries. It is a very small device, as you can see, and therefore it's easy to monitor at the bedside. It has higher contrast images than OPS, so therefore the SDF is mostly preferred. And what we know is that there is a good intra and inter-observer variability also in critically ill patients. However, this is still not used in daily clinical practice, and the main reason is the time-consuming analysis. So if you want to analyze your perfusion, you have to kind of draw all the capillaries